Joining us to talk more about this is Dr. John Whyte. He's Chief Medical Officer at WebMD. Good morning. Thanks for being with us again.
Welcome back, Dr. Whyte. Good to have you.
So please welcome my dear friend, Dr. John Whyte.
What if your family doesn't remember much?
Yeah. that is common. Or, you mentioned FOMO and FOGO.
Yes,
There's
right.
FOFO, I call, fear of finding out.
Yes, yes, FOFO.
So you have to probe a little. You might ask, be a little bit of a detective, but that's going to tell you whether you're at greater risk.
What do people need to know that they can do to really reduce their risk of falling victim to this disease?
People think it's genetic, but the reality is 70% is caused by lifestyle. And the biggest change that people could make today is to treat food as medicine.
John, I know during the winter months, it becomes significantly harder to exercise, but is exercise important in reducing the risk for these conditions?
Absolutely. We all have the risk right now. It's too cold to go outside, to go to the gym. I mean, we can exercise in our home, but most of us aren't doing that, are we? So the physical inactivity, we all gain weight. It's not like we're bears and we have to hibernate.
Still with us is Chief Medical Officer of WebMD, Dr. John Whyte, and we're answering the most searched medical questions on WebMD. All right, so the first most searched question is, should I go gluten-free? So what do viewers need to know here, John?
What they need to know is you should go gluten-free if you have celiac disease, which is a condition in which you're allergic to gluten, which is found in wheat and barley. And sometimes folks are saying, hey, can gluten-free be a healthy option? Well, the problem is, although it might help you avoid some cookies and white breads, I don't want you avoiding whole grains unless you have to, because we do know that whole grains can reduce your cancer risk.
Now, Dr. Fauci, at WebMD, we're seeing a lot of traffic in terms of anxiety and stress. And one of the things that we've been talking about to people that come to our site is, taking care of their mental health, taking a break from the news. So I know a lot of folks want to know, what does Dr. Fauci do to take a break? And I saw that, you've been an avid jogger, now you're a power walker. Some of my colleagues said, I must ask you, what's on your playlist if you have one, or do you walk in silence?
No, I walk with my wife and my daughter's dog.
Can we do a rapid fire with Tim Tebow?
All right, let's go. All right. Put this down.
Cardio or weightlifting?
Weightlifting.
Coffee or tea?
Coffee.
Now, this kind of is a trick question because I know the answer. Avocados or bananas?
Avocados.
Now, for our viewers that don't know, why is that a trick question?
What more can they be doing? What more should they be doing to keep their residents safer?
And Craig, thanks for having me back. These are heartbreaking stories in terms of our most vulnerable populations are most impacted by the disease. And it's really what, we've been doing. It's trying to have that social distancing. It's making sure we clean and disinfect surfaces. Everyone has good intent.
And I often give the example, what if I told you, normally you make 25 cookies, say for people at work for a party. But all of a sudden I say, you know what? Tomorrow we're having people come back into the office. I need 150 cookies and you need to make them tonight. What's going to happen? You're going to be stressed, you're going to be rushed, and you're going to make mistakes. Some are going to be burnt, some are going to be undercooked, some are going to look like cookies. That's what's happening with stress in your body. Your cells are now dividing more quickly and they're making mistakes.
As a physician, I'm constantly searching for innovations in medicine and new ways to help patients. And I found it.
Loved having him on.
Dr. Whyte.
Yeah.
And you know what's so funny? We usually go to WebMD to Google. We'll just call Dr. Whyte.
Just call Dr. Whyte. Get Dr. Whyte on TV.
Exactly.